So the hospitals are still stretched thin because of this, so I'm not trying to take away from that. But if 40% in some hospitals, 40% of the people who have COVID don't necessarily have problematic COVID. They're there because they got in a car accident. They're there because they bumped their head, and they're being included as in the hospital with COVID. That number seems kind of misleading.
Yeah, I agree, Jake. It surprises me that they have not been able to parse out that data more carefully. I think the data that Dr. Walensky is quoting is from New York State, and we've been following that data as well. And I can show you what we've seen, sort of tracks with what she said. But out of all the patients that are in the hospital, about 57%, these are COVID patients, admitted because of or complications from COVID, 43% admitted for other reasons and then diagnosed with COVID. I think, there needs to be transparency about that in terms of for or with COVID. The only thing I will tell you, Jake, again, working in the hospital, is that at the time someone is then diagnosed with COVID, even if they didn't come in for that reason, it does take up a lot of resources then in terms of infection protocols, personal protective equipment, more testing, all that kind of stuff. So even though that may not have been the initial impetus to bring him in the hospital, it just requires a lot of energy and resources on behalf of the hospital staff and the testing and all that sort of stuff. So we need to get better about being able to see this data. New York State, I think, is one of the few states that's presenting it that way, for or with COVID, but other states should follow suit. The American Health Association says they have a hard time sort of separating out that data, but clearly New York State's been able to do it. Other states should do it as well.
Yeah, we're 2 years into this, and we need the clearest picture possible. If somebody's in the hospital with a broken leg and they also have asymptomatic COVID, that should not be counted as hospitalized with COVID, clearly.